Good afternoon, everyone. Welcome to our Ask the Experts wrapping up the month of October. So we are so glad that you are with us here today. This is a new topic for us, and we're so excited to bring you truly an expert in her field. So today's topic for our Ask the Experts is all about cosmetic and medical tattooing. So there have been so many strides in this professional area that are available to all cancer patients. So we're really excited to be here with Mandy Sauler to talk about the work that she does and some of the new procedures that are available. So we are so excited for today's Ask the Experts. If you are new to Ask the Experts, we are streaming live on Facebook. I know some of you have sent us questions already, but know that you can connect with us live and feel free to submit your own questions or perhaps share your own experiences with cosmetic and medical tattooing and how that worked out. So feel free to engage with us live. Just to share a little bit about our expert today and what today's segment will be about. So we have with us Mandy Sauler. She is a renowned medical tattoo artist, and she will be live tattooing eyebrows for none other than our founder, Unite for Her, Sue Weldon. So after Sue's own experience with breast cancer, her eyebrows thinned and became quite sparse. And so Mandy will show us how to transform eyebrow tattooing, the entire process in an effort to restore that natural look. So during the live session, you can ask questions, like I said, and gain insight into what that procedure looks like, maybe taking some of that fear and intimidation away, as well as learn about the broader scope of services available. Sue has worked with Mandy in the past for her 3D nipple tattooing. And like I said, the field has really opened up tremendously. So we'll not only be touching on eyebrow procedures and nipple tattooing, but we'll also be talking about different treatments for scars via medical microneedling, eyelash procedures, hair thinning, SMP, otherwise known as scalp micropigmentation. So really a lot to cover today, but we couldn't bring you this information without the help of our sponsors. So let me share our screen. So, of course, we want to give a big thanks to our education sponsors who continue to encourage us to bring the best in the industry to our Unite for Her community. So today's presenting sponsors are West, Merck, and Daiichi Sankyo, with additional support from GSK, Lilly, Gilead, Pfizer, and Immunogen, now part of AbbVie. In addition, we have so many more education segments coming to you. This is actually the first of two Ask the Experts that we have happening this week. So a little reminder, join us on Friday to kick off November. So Friday, November 1st at 1 p.m. Eastern Time. Again, we will be streaming live on Facebook, and our topic will be breast imaging myth busting. So we will be joined by none other than the booby doc herself. If you are following her on social media, Dr. Robin Roth, she will be speaking with us and talking through some of the common myths around breast imaging, answering your questions. We've already received some great questions so far. And she'll also be touching on some new self-breast exam guidelines that have come out. So to submit your questions, you can go to uniteforher.org/experts. And again, all of our events, including today's Ask the Experts, are recorded and will be available live on our Her Library. So with that, let me share a little bit more about our expert today before I bring on our special guest. So Mandy Sauler loves what she does, and it shows in her work. She's been in the tattoo industry for more than 30 years, earning her reputation of being a fine line artist due to her natural ability to create smooth and steady lines along with her attention to detail. After gaining interest in permanent cosmetics, Mandy completed an intense training program at the Florida College of Natural Health with the Whitney Center for Permanent Cosmetics. Throughout the past 9 years, she's specialized in micropigmentation, working diligently to perfect her craft, and we'll see that today. She received her board certification from the American Academy of Micropigmentation and is a member of the Society of Permanent Cosmetic Professionals. She continues to seek out the latest and greatest advances in technology, procedures, and products. Currently, Mandy works in conjunction with many doctors and one of the top hospitals in the nation, promising a professional and sterile environment, which is something certainly that we all want for these sorts of things. So with that being said, please join me in welcoming our expert today, Mandy Sauler, with Sue Weldon. Hello, how are you both?
Can you see us good?
Yeah.
Yay. Okay, so we're here today finally, and we're going to do Sue's brows. So we already started to draw and map out her brows. Her brows just are there, but they're just started thinning in areas where they just kind of never grew back. And so we're just kind of filling those areas in. We're going to use a machine. And I just wanted to touch on this briefly because I know that this is a confusion for a lot of people. There are terms out there a lot that people hear of, like microblading and tattooing and all of these things, right? So microblading is actually a hand tool. I'm not microblading her. I'm using a machine, and the machine can give you the same look that the microblade can give. So where you're creating baby tiny hair strokes. So I drew them in there first. We drew the shape on. She approved the shape. We showed her the color. She's going to be so happy. So we're just going to give her some hair strokes, a little bit of fill in between the hair, or wherever the hair is kind of missing, we're going to go ahead and fill in. We can do this for, someone that has a lot of brows, and we don't have to get rid of the hair, or someone that has no eyebrows at all. We can kind of create a whole new eyebrow. So it's just a matter of what you need in the brow area and creating that shape. So you ready? Ready. Okay.
Love that.
I've been talking to Mandy about this for 10 years here.
She has years.
We're all excited to see it.
Today's the day.
Wonderful. So, Mandy, share a little bit about, especially for someone that may have had some hair thinning as a result of treatment or, hormone medications that they may be on. Is eyebrow tattooing versus eyebrow microblading, is one better than the other or more appropriate, for our Unite for Her community?
I would say it just depends. It's not necessarily based on the treatment that you're going through. It's more so evaluating your skin type. Certain skin types are going to be good for microblading and some aren't. But I prefer the machine over microblading anyway, just because it's not cutting the skin. It's creating little punctures in the skin versus cutting. Where the hand tool is actually taking needles like this and it's actually cutting the skin. So over time, you keep cutting and cutting and cutting. I just prefer the machine. Plus, they have this little tiny needle. It's so tiny. It's like a nano needle. It's like almost like if you think of the acupuncture needle. You can create the same hair strokes you can with the machine as you can with the microblading. So, and it all depends on the depth of it. So one's not necessarily more permanent than the other. They're all going to be, so they're not, one's not tattooing and one is, people say tattooing versus microblading. They're both tattooing. The definition of tattoo is implanting pigment into the skin. So they're both tattooing. It's just two different techniques. So I just wanted to, kind of address that too, just so people know, the difference between the two. But it's really just the skin type. I would say people with big pores and oily skin, not as great of a candidate for the hair strokes, but we can do a nice powder fill. With Sue, we're going to do a little bit of a powder fill in the tail, just real light, and then we're going to blend it to almost like an ombre and give her a few hair strokes in the front. Plus, her brows kind of stop growing in the front, so we're going to give her that hair stroke look in the front, and it's going to bring it out. We can show you the before photos so you can see the difference. So are you ready? So we're just going to do a first pass. So what I do is, we already put a little bit of topical, but she's been sitting for a while, so we're doing a little topical. We're going to do one pass first, and that's going to get the shape that I drew on. So we're going to follow this exact shape, and then I'm going to put some more anesthetic on it, and then we'll move to the other side and move back and forth, okay? So we're just going to get the shape now. It usually is a little bit more sensitive on the front of the brow than it is on the tail. but nothing extremely painful. You okay? Okay.
How
We're
long,
just gonna-
how
ahead.
long does the entire process take, Mandy, from start to finish, like drawing on the shape and moving through? How long might a person expect to be in the chair working with their professional?
Well, they're professional or me. No. So it just depends because I would say it depends on the level of experience someone has. When I train my new artists could take, 2.5 hours to 3 hours to do something that takes me 45 minutes to an hour. So I would say on average, I would say like an hour to 90 minutes. So an hour to an hour and a half for most people. I would say around there could be a good time frame for most people. Takes me about an hour, I would say, for the whole process. Bringing someone in, talking to them about shape, and I help, through the whole process of the shaping too. I'll measure the face, I'll look at the shape of the face, and that's how we determine what shape would be best for that client. The other thing too if they have hair there, we can just follow the natural shape, but just enhance it. So just finding the great shape for them. I'll draw it on. We do that whole process together. So it's not like I draw it on and you're like, I just say, sit down, this is what you're going to get. We kind of like, I'll show you and you approve it. Or if you're like, no, Mandy, let's go a little thinner, we can go a little thinner or adjust it. So the whole process is really done together.
That's really wonderful. And what special techniques are used to create really natural looking eyebrows? Like, is it using the machine that you like, or is it really just skill to create hair-like strokes? What goes into that?
Yeah, it's mostly just skill. It's, perfecting your craft, practicing, learning. It's actually everything, it's learning different skin types and how to work on them. We may need to adjust our needle size based on the person's ethnicity or skin type, because the thickness of the skin or the thinness of the skin. So we want to make sure that we're using the proper tools for each client. And that's why I don't think, I would say, like, I wouldn't just say everyone can be microbladed. I think there are people that can be, and it could be a very good result with a microblade, but it has to be the right skin type, the right age, the right person to have that procedure done and for it to look right over time. The one thing I do suggest too is if you're going to find someone to look for an artist, you want to see their field results because that's one of the most important things. I mean, it can look good, very good after it's done, and it'll look darker in color and everything, but you want to see how it feels because the healed result it will change as it heals.
The healed results. Okay.
Mhm.
And is that something, that we could ask the professional to see? Would you suggest perhaps doing a little social media digging to see what
Well, yes,
results look
and
like?
social media is good but bad, right? Because Photoshop and editing and things like that are done a lot. So I would suggest visiting the person for a consultation, asking them to see before and after photos in person. It's really just meeting the artist, getting their experience, and making sure that you're seeing their before and after photos, maybe before, during, and then healed, so you can see the actual process and what it looks like that they've done. Because it's sad, but there are a lot of editing stuff on social media.
Yeah. All right. I just brought you live on the screen so that we can make sure we can see that closer. And I think, one of the main questions that comes in with any sort of procedure like this is really around pain. So we'd love to hear if the tattooing is painful or what sort of numbing techniques you do use.
Okay, so how are you feeling right now so far?
Not at all. It's so interesting to me because I expected it to be worse. And it's just like a vibration. I mean, it's prickly, but yeah.
So what we usually do, and it depends on the procedure. So if we're working on a brow, I might do a prenum for maybe 20 minutes or so. We'll put that on the brow. Then we can draw the brow on. Sometimes I don't do prenum. It just depends on the client. We usually will do a first pass very superficially, so it's not extremely painful. And then once we get through that first pass, we put another anesthetic on. And this is just a topical. It's like a lidocaine, petrocaine, topical anesthetic. It's not anything that's super strong, but it's enough that will keep the
edge off.
yeah, take that off and keep it a little comfortable.
So that's why I'm doing that.
Well, yeah, but it's, you know, in different areas, they may feel a little bit more than others too. So in the tail here, it's actually not as bad, and maybe that's why she's okay. In the inside here, it's a little bit thicker skin. It gets a little bit more sensitive in there, and once I start doing the hair strokes in there, you might feel it just a tiny bit more.
Okay.
But once I get through that first pass, I'll put the other anesthetic on. Now, the reason why we put a different anesthetic on is that one works once the skin is already open, where the other one is just a precluding anesthetic. So you can only use it prior to the procedure. But now that's different for different procedures. So if you are going through breast reconstruction, it just depends on your reconstruction. Some people feel something in one side of the breast and nothing on the other side of the breast. Some people are completely numb, completely at all. They don't feel anything at all. I would say, so I usually typically don't start with an anesthetic to see if there's any feeling at all first, because there's no sense in using it if we don't need it. So we just kind of go over it real lightly just to see, just with the tip. And if there's feeling, then we'll use a little anesthetic to make it comfortable if that's what they choose. If they're okay with it, then we just do the procedure without it.
Love that. Okay. Let's talk a little bit about maintenance, because this may be something that perhaps someone is thinking about. They want to make an investment, but how long does it last? What is the maintenance or touch-up schedule like? What does all of that look like?
So that's all depends on the client themselves. What's their lifestyle? Sun exposure is probably the number one thing that's going to fade the area. And since it's on our face, we do get sun in the winter and, you know, in the fall, like whenever we're walking, when we're outside. So just recommend keeping an SPF on them. I get like there's a little chapstick with SPF in it, and you keep that in your purse, your pocket, a little on your lips, a little on your brows. It keeps them darker. It keeps them the color and nicer and longer. Otherwise, I would say on average every 1 to 2 years, just depending on the lifestyle of the client. And they'll always be there. They'll just fade gradually over time. So yes, if you wait 5 years, they're going to be pretty faded. But I would say on average, it's 1 to 2. Whenever you feel like it's kind of getting to that point where you're like, oh, I just feel like I could use a little refresh, is what I usually suggest, because it's not the same for everyone. Okay. Now, someone also with like a blonde color will be a little lighter than someone that has really dark brown brows. So they might fade a little faster, but typically I would say still average 1 to 2 years.
Okay. Yeah, so you get some good leverage out of that. Some long time if you're taking care of your brows, like you said, keeping them out of the sun, doing the things to really protect the integrity of it. Now, going into this procedure, if someone is using certain skincare products, is there anything that you might tell your patients, hold off on doing this leading up to it, or any particular types of products or acids that someone may use on their skin that may affect, you know, how well this turns out and last going into the procedure?
Yeah, I mean, you want to be careful, like afterwards, no like retinols or glycolic acids, like anti-aging products and things like that. You don't want to put it right over the brow because it does break away the top layer of the epidermis of your skin, so it could fade it. Prior to the procedure, there's not a lot of pre-op for the procedure. I usually just recommend no blood thinning products prior, like 24, 48 hours prior, no alcohol the night before. Unless you have to be on a blood thinner, I usually would, you know, it suggests that if you are on a blood thinner, if you ask your physician to be off of it for a day or so. If you can't, that's fine. There's certain ones that are okay. So most of the time, you know, it's okay. So just it's not a very invasive procedure. It heals really fast. So there's not a lot when it comes to like pre-procedure wise.
Okay. And you bring up a good point, actually. So for our Unite for Her community that is living with metastatic disease or recurrent ovarian, right? They will be on ongoing treatment.
Mm-hmm.
Is it safe for those patients to have this procedure done if they're actively on a treatment medication?
Yeah.
Yeah. How do they handle that?
So yes and no, it just depends. So usually they will go to their physician and ask if they're okay to have it done. And I have done a lot of long-term chemo metastatic breast cancer patients. So what they'll usually have them do is, and you, of course, you want to check with your physician, is to have a blood count done and check what your blood cells are at that time. And if they feel like they're okay for that day, then they'll approve them to have it done. So yes, it's still an option to have it done for long-term chemo. If someone's undergoing chemo during the time of their treatment and stuff, I usually will, say, wait until after. Some people will also have it done prior to chemo. So it's there, and then if they lose that eyebrow hair, then they have that base. And the hair will go back, and then it'll grow back right over the area that we tattooed.
Wow, that's amazing.
Now.
Yeah. And I want to encourage our viewers that are watching live on Facebook, please feel free to share your questions or inquiries as we move through and watch Mandy work. It makes us all really inquisitive to learn a little bit more about this whole procedure.
Yes, so, and I'm live on mine too. So if anyone, I'm not here answering questions, guys, but if you want to go on to Unite for Her on Facebook and ask questions there, then I can talk and we can, I can answer any questions that you have.
Perfect. Let's talk about side effects or risks associated with eyebrow tattooing. For those with breast ovarian cancer, and I know we had one question come in from our community. One of our members said her osteopath told her there was an increased risk of lymphoma through tattoo ink. Is this true? So can you share a little bit about potential risks to our patient population, if any, or side effects, Mandy?
I'm not aware of any side effects. I haven't read any studies that were, cancer causing or anything like that. So I can't really speak on it to that extent. But, I've had, I don't know. That I would just say I don't know in that sense. I don't know enough to speak on it. I haven't read any studies. I've been doing this all my life, and I can't speak on it because it's like I say, like I have people that have tattoos from head to toe and are completely healthy in their 70s. But I don't know.
Is there a risk for perhaps someone having an allergic reaction? Are there certain questions that you might ask that, if someone has, you're like a shellfish allergy, they may be allergic to tattoo ink, something like that. Is that of any concern, or any other questions that you might ask about?
That's a great question. No, I mean, I've been tattooing for almost 30 years now, and I've never had an allergic reaction from the pigment itself. Now, years ago, actually, the reds sometimes, this was so far long ago, but the reds sometimes people would get irritated from, but never had allergic reaction to the pigments. Now, sometimes people would have allergic reactions to like the topical anesthetics, or maybe like we used to use Neosporin and stuff. We don't use that anymore to heal, but people would be allergic to neomycin and things like that, but never the inks. And I have people that are allergic to everything under the sun. They would come in and they get samples of my ink and they take it to their dermatologist. And I've done this hundreds of times for people that are very allergic to everything, and they're absolutely fine. We used to do test spots years ago behind the ear with a little dot and see how it came back. We actually stopped because it hasn't been an issue. So it's pretty safe. There's also a lot more things on MRIs and stuff like that. I know people ask, is it safe to have an MRI when you're being tattooed? If you go on the Society of Permanent Cosmetic Professionals, the SPCP, they also have things on there that educate you on those type of things, but it's all found safe to be able to have all that done.
Wonderful. That's really good to know, and all great points to bring up that, I'm sure cross someone's mind as they're sort of assessing if this is something that they want to try for themselves, for sure. So, certainly safety, being sterile, cleanliness with something like this is, an area that we want to make sure our professional really holds in the highest regard. Can you share a little bit about the steps that you take, and maybe for our members that are across the country, if they're pursuing something like this, they can keep their eyes peeled on what they want to look for to ensure that the facility that they go to has the highest quality of cleanliness and sterile procedures?
You want to make sure that someone, and it's a good question because not all states have a lot of laws on tattooing. Some have very vigorous laws and some have no laws at all. So You just want to make sure that the person is bloodborne pathogen certified, so that they're using universal precautions and staying safe. And the other things that you can do is obviously the cleanliness of the clinic, making sure that they're a reputable place, making sure that you do have you see them as they're setting up. You can even check, like, just making sure that they're using all new needles. When they open the needles, they should have a sharps container where the needles go into. So, but usually, they should have a bloodborne pathogen certificate. We don't have any laws particularly outside of the city of Philadelphia, but we still meet all the, like, we make sure we're bloodborne pathogen certified. They can be also part of certain organizations like the SPCP or the AAM. They're what also give us some standards, and to help us, like artists that don't have laws, to meet those standards.
Perfect. Yeah, really good to know. We take this stuff seriously for sure. Reducing risk of all things going wrong. So that's really some good points to call out for sure. So let's talk about the varying medical tattooing services that are available, including, what you offer at the Sauler Institute, because the degree of variability that you offer to your patients really speak to the evolution of this whole space, right? So can you share a little bit about some of the new procedures that are available for what, cancer patients may be experiencing?
So along with, not just eyebrows, but we do the aerial nipple tattooing. So that goes for whether you've had nipple reconstruction or you didn't have nipple reconstruction. We can create a 3D nipple if you decide not to have the nipple made. So if they don't make the reconstructed nipple, we can create the illusion of a nipple, which is really cool. And sometimes the only alternative for some patients, if they've had like an implant reconstruction or radiation and things like that. And the doctor sometimes will say, like, you could just move forward with tattooing at that point. Yeah. So there is a lot of new advancements in that, and the artistry of it. And then I noticed that a lot of times patients will have scarring after their reconstruction, whether they have the horizontal lines or the flat lines from the deep flap. Port scars, that's a lot. And I know a lot of women like to wear like a V-neck shirt and stuff like that. So we also work on scars a lot. So scar camouflage is something that's being done. And now we've had a lot more advancements in it with microneedling. So it's not just lighter scars where it's hypopigmentated. And that's a hypopigmentated scar means it's lighter in color. We can also do pink scars and darker scars, or hypertrophic scars if it's a little raised. And, we can kind of work on treatments to get the scar to a better place. So if you have a lighter scar, we can use color to repigmentate it. Or if you have a pink scar, we can lighten it over time. And there's a series of treatments with that, depending on the scar. So with that, each individual would need to just either schedule a consult, or a lot of our clients will just send us photos through our email, info@saulerinstitute.com, and we can take a look, and then I'll evaluate it and kind of come up with a treatment plan for the scar. A lot of times, if you're coming in for breast reconstruction, for aerial nipple tattooing, and you have scars, I'll do a needling session for free with your aerial nipple tattooing. If you're a candidate for microneedling, I'll do that during that session. But it really does help. And then we also have things like SMP. So if you have hair thinning and it hasn't grown back, you can do little tiny hair follicle dots in your scalp to make the scalp look a little fuller and thicker. And that works good if your hair is you're thinning and you're seeing your scalp. We do that a lot for our breast patients or if they've undergone chemotherapy.
Is that something that you would do just sort of along the crown or in the front, or is that something that you could do across the whole head, depending on the degree of thinning?
Well, so a lot of men do it for balding. So they'll do their whole entire heads. They'll even create a hairline. So you can really get as deep and as fancy as you want with it. I don't suggest for women to really create a whole hairline necessarily, just because we can always recede, and we always want natural results. So just kind of blending or giving it a nice soft look we can fill in just slightly and give it in the front. But I would say anywhere within the scalp, you can create some density.
That's amazing. Okay, so I want to go to a couple questions that came in from our community prior to our Ask the Expert segment today. So going back to scar microneedling, one of our community members said for a lumpectomy scar. Can you talk a little bit about medical microneedling, particularly how much would the scar typically be reduced percentage-wise or so? Is this a procedure that may be covered by medical insurance? And how many sessions might it take to really get good results? Can you speak a little bit to that, Mandy?
Yeah, so each scar, like I said, would really have to be analyzed and judged. I mean, some scars are worse than others. Some scars are raised and some scars are flat, some scars are pink and some scars are white. So it just depends on the treatment. But if you're doing needling sessions, I would say needling is usually typically on average like 3, max 6 sessions. And those are usually spread like 6 to 8 weeks apart each session. And then we would do needling. We always typically do 1 needling session before we do any camouflage on the scar, just because it really preps the scar. Now, I know I'm saying needling, but like, what the heck is needling, right? You're like, what is that? What that is? It's called microneedling, or we call it dry needling because we're actually doing it with our tattoo machines, but it's dry. It's no ink in there, right? So we're actually taking the needle and we're just really superficially, like almost just going over the scar really lightly with a tattoo. So what it's doing is it's like, oh my gosh, you just put trauma there, you know? And then what's happening is your white blood cells and all your collagen and all that stuff come up to the surface and they're like, I'm gonna go heal that area, you know? Like that's what our body does when we have trauma. So it's actually healing the scar. So it's our own body healing itself. It's like, I love it. It's like the coolest thing ever. Yeah. It's so cool how our bodies can do that. But what I've seen with scars and like, you know, it really helps with like, you know, with our deep flap surgery patients that have the abdominal scar from, you know, hip to hip from like the stomach, the tummy tuck. You know, we can lighten those and or help them. But it's just, you know, it's just a matter of treatment. So it might be like 3 to 6 sessions of needling, depending on the scar. Now, sometimes I could get it good in 2. It just depends. So we kind of get it to, we really compare photos of the treatment during your process to see how much improvement is happening. If I see any shrinkage, if I see lightening, then we'll move forward with more needling treatments. If not, then we resort to camo, which would be with pigment.
Okay, so it's good to know that there's options and you know, it's sort of a fluid thing. You can sort of assess as you go along to see what the patient needs.
And insurance doesn't typically cover scar camouflage. You know, it's hard enough to get some other things covered, but I know there are some coding for like maybe alopecia and a certain other treatments, but scars usually not a billable procedure.
Okay, maybe one day.
Yeah, hopefully.
Yeah, I know.
The 3D
Okay.
is over.
3D nipple tattoo is covered. Yeah, well, so it depends on your insurance company, but I would say if
Part of the surgery, right?
it is a law. So put it this way, there is a law. So if your insurance company tells you no, and unfortunately you might have to fight it because it is a covered procedure throughout the reconstruction process. Don't allow them to give you a hard time and fight for it because they should have to cover your aerial nipple tattooing.
Wonderful. Okay, so on the subject of nipple tattooing, a couple more questions that came in from our community. So one of our members submitted a question. Her plastic surgeon did 3 fat grafting surgeries within the last year. Each time he's saying he injects her skin where the nipple would be, but she doesn't notice any actual raised nipple. So is that something that she should visibly seam? It doesn't appear like it's taking at all and her skin just scabs away. Is there any way to increase the chances that it looks more raised with the nipple tattoo?
Oh, absolutely. Yeah, that's a very, very common thing that we do because a lot of times with nipple reconstruction, they can come like sometimes maybe they flatten out, like you said, or one will be bigger than the other, or one's a little higher than the other. With the tattooing part of it, I really look at the whole thing and we try to create that symmetry where there's not. So we'll balance anything out. If I need to make one nipple bigger or, you know, balance them out, we'll do that. Any kind of thing like that that we can do on our end to balance or enhance or can make the nipple look more 3D, we will. So if one's bigger and I need to make the other one look more 3D just to make it pop so they both look like they're popping out. So we can definitely make give it that enhancement. Even people with nipple reconstruction, I'll still create more of a 3D shadow just to really give it that nice color and protrusion and that realistic look.
That's great. And it doesn't matter if the skin is stretched at all, that the integrity of the skin in that regard doesn't make a huge difference.
No, not really. I mean, I've tattooed people that have had radiation that are so thin, super, super thin. It's just adjusting the way you work. We're only going so superficial. When you tattoo, you're only going into the dermis, which is about 3 layers of skin. We have over 7 layers of skin in general. So we're not even in through the layers of skin. Now, yes, is it stretched and it's thinner? So that means we need to adjust our nerve depth and work that way. We need to work a little bit more superficially. So we would work a little bit more superficially with someone that has, you know, thinner skin than someone that has like a deep flap, and we're working on stomach skin, which is a lot thicker.
Mm-hmm. Okay. So let's get an update on what you're doing now. Sue, how are we feeling? Let's check in with the patient.
So she's about to tell you how it feels now after I did one pass. So I did one pass, if you can see, I did one pass. I put the anesthetic on. So I did a little light powder fill here. And then as you can see, as she turns, I kind of did the strokes in the front, and now I'm going to do another pass on it, but I have the anesthetic sitting, which you can also see if someone's anesthetic is working too, which is kind of cool. The skin kind of blanches, so it turns a little white around the edge. It gets a little white, and that's just
we
from
can
the
see that.
Yep.
Yeah.
And that will also go away in an hour or two. So it will also make the appearance of this a lot darker. So when she first leaves, this color won't be true to the color that I showed her, because it probably appeal a little darker, almost a little warmer in color, because it does. I mean, she's not bleeding, right? But it like almost with a pinpoint brings the blood flow to the surface, and it may pinpoint here or there depending on the person. But it may look a little warmer or redder in color because of that. So that's why I said you want to see the healed results, because it's going to change over to as it heals. So now we're just going to do another pass on it, and I want you to tell me how it feels now.
Yeah, I wanted to go back to the nipple tattooing.
Okay.
I just, I waited, as you know, a lot of my community knows my story, and I waited 9.5 years, right? And finally got those nipples put on. It was such a lift for me, because I no longer noticed the scars. My eye got drawn to the nipple.
Yeah.
And I didn't think I needed it. You know, I was like, I'm fine. It's good enough. And when you did those, Mandy, it changed my whole perspective. When I walked by a mirror, I was like, oh my gosh, they're back. Like I didn't see that for almost 10 years. And I just felt like, oh, it's fine. You know, I survived. I'm good. And it was just such a change that I don't know why I waited so long, but I know that, you know, you weren't available then. Like, I don't remember the 3D nipple tattooing being as good as it is. 20 years ago, right?
Yeah, right. There wasn't a lot of even people doing it back then. It was being done in medical facilities, and they were kind of just putting one color on, and yeah.
But it was just such an emotional lift that I didn't expect to happen, right? Like I didn't think I would feel so good about that, and I did, you know. So. And we deserve that, right? And
that's okay that you waited too, you know. It's like I feel like whenever you're ready, and I feel like a lot of times you go through so many appointments. Sometimes you're like, okay, I just want to breathe for a second, and then I'm gonna take my time, and then I can do it. You know, I have people, same thing as Sue. I have people all the time. I just had someone yesterday, and she was 5 years post-op, and she's now deciding to have it done, and she's, you know. And then most of the time, like Sue, they're like, I can't believe I waited this long. This was so good, but it's okay. You need to take a break. You need to take a break, and you can do it whenever you want, which is the great thing about it. It's not something that you have to do immediately, but it does create a focal point, which then takes away from all the other little imperfections. So if you feel like one breast is slightly bigger or lower, or there's a scar. And that's all you see when you look in the mirror then. But once we put that focal point there, your eyes don't even go to that. Like it goes right to the tattooing then and your nipple and areola. And it just takes away from all that. So that's where we create that symmetry and it just changes the whole appearance of it.
Yeah,
So I don't like, want anyone to feel like it's a vanity thing or, we're bringing back something that you've had and you went through something. So these things are taken away at that time. So it's definitely just bringing back something that you had.
yeah. And I'm so glad you brought this.
It's beautiful. Like it's so beautiful, Erin. Like you're just so surprised. And my scars, my scars go end to end, right? So the fact that that no longer was a focal point for me, I haven't seen that in 9 years, and it was really emotional and in such a good way.
Yeah. And I'm glad you used, around vanity, the thought around vanity. I feel like we have that conversation so much around hair and hair loss, and people say, I know it's vain, and we say, no, 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 it's not at all. It's part of who we are, right? Hair makes us who we are, the shape of our body and it all makes us who we are. And like you said, it's kind of bringing that self back, right? And it should never feel like this is a vanity decision at all. This is supporting you. Absolutely.
And it's not for anyone else.
Correct.
It's for you. That's it. It's not for anyone else. So it's not for your mom or your husband or your kids or whoever. It's for you. So anytime you look in the mirror, it makes you feel a way. And when you feel good, when you look good to yourself, you feel good. So it just gives you a different feel,
Yep, absolutely. So regarding the nipple tattoos, one other question that came in from our community, Mandy, one of our members had her nipples tattooed in 2010 after a bilateral mastectomy and tram flap fat replacement instead of artificial implants. Her nipple tattoos have completely faded. So you talked a little bit about whether insurance might cover this, but can she go back and have this re-tattooed, and might that be covered under this law or otherwise?
It should be, yes. I've had people that have had multiple treatments for their nipple tattooing, and they did submit it to their insurance, and it was covered. So, but once again, this is definitely something that, depending on your coverage and your insurance company, that you want to just follow up with them. We can give anyone any coding that they might need that they can call prior to their insurance company too, just to make sure that it would be covered before they, have the procedure done. Now, the other thing too is the pigments have changed over time. There are two different types of pigments. There's organics and there's inorganics, and what is all this? And so years ago we used to use different type of ink for cosmetic tattooing, which was there. It's more of an iron oxide ink, and that fades faster over time. So a lot of what was happening is a lot of patients and a lot of medical facilities are still using something like this. Some of them, not all, but it fades a lot faster. So I actually did a study at the University of Penn, and we did the two different types, and we followed the patients over a year time, taking pictures and the fading process. We did random, one with one and one with the other. And we came to find out that the organic ones, that traditional tattooings, are going to hold longer for the patient. So there's no reason why someone should have to come get their nipples tattooed every 6 months. Like, no, So there are different advancements and different things that, we're using that could hold up more. Now, it also depends on the amount of scar tissue someone might have to. Someone that has scar tissue or maybe stretch marks from their deep flap, because the stretch marks are going to come from the stomach to the breast, and that's okay. But you may see a little bit more color loss over time with someone that has more scarring than others. So you might just have to come back for a refresh sooner because of that. So there are certain things that are going to affect it. So every case is going to be different depending on your reconstruction.
Okay, but good to know that really, I mean, again, sort of with the techniques that have evolved over the last several years, that the products that you're using really.
Oh, this is wireless. Like, do you know when you guys, I used to have to make my own needles, okay? I used to have to sit and use solder and flux, and so this is 5 needles, right? We have 3s, we have 1s, You just have to solder each individual needle together. So advancements in tattooing, yes, I'm there. I'm like the Stone Age.
You're the
Okay?
forefront, right? You've seen
Now
it
they
all,
come
Mandy.
pre-packaged, pre-sterilized, ready to go, you know?
I
So
love it.
this is wireless. We used to have, I'm sure you guys are saying, that's a tattoo. Like, you know, you hear that big old coil machine with the loud
Yeah.
noise and the pedal and, you know,
Yeah.
cords. No, no, no. We have lots of advancements in tattooing.
Amazing. Amazing. Okay. So let's talk about who's a good candidate for medical tattooing. Are there any restrictions or conditions that may prevent someone from getting any particular type of medical tattooing?
Medical conditions? Like things we talked about already, like maybe undergoing chemotherapy. Um, Not a lot of medical conditions.
Blood thinners, do you have to know that?
Yes, blood thinners, but no. I've checked with a lot of people on blood thinners and they're absolutely fine.
Mhm.
You know, for me, it's yes, we do want to be safe and we want to make sure that there's certain things that, you know, autoimmune things and things like that, if they are going through treatment, that they're healthy. And I always resort to, okay, has your doctor approved you to move forward with tattooing? And then we move from there. But I mean, this is coming from someone that's been tattooing a very long time, right? When we worked at the shop years ago, there was medical forms. Anybody that walked in could come in and get a tattoo. So it's not as invasive as you think. When you're going through treatments, you're thinking all these invasive procedures and things like that. This is not going to take a long time to heal and it's very superficial. We're almost going to treat it like a surface scratch. So it's not that invasive. But yes, we do want to take precaution on certain things, like, you know, maybe not doing anything that's going to thin our blood. And thinning the blood is really only going to lower our chances of our pigment retention holding as well. It really won't hurt you much otherwise.
Mhm.
So it's not a lot of risk in it, say.
Great. Very good to know. So let's talk a little bit then about the aftercare and what do you advise your patients? What should they know to ensure that, you know, they achieve the best result? What does that look like? And what does the healing time overall look like?
So with brows, it's just going to be about a week of healing, week to 10 days of healing. You may see a little flaking, you may not see much, depending on the procedure that you have. You shouldn't see huge scabs, just maybe a little dryness and exfoliating, especially with like the hair strokes. You're not going to see a whole lot of scabbing with that. We're going to give you an aftercare lotion to keep on it. And this lotion is like an all natural lotion. It's grapeseed oil. It's the best. Everybody loves it. You can use it on other parts of your body too, but it's just a really nice healing lotion that you'll put on there. And you just use it like once or twice a day on the brows. You want to avoid direct water with it. So, you know, soaking in any water, don't let the shower beat directly down on it just for the first few days. Because it's kind of like you have a cut, you know, you kind of scab it. You have to, if you get it wet, you kind of have to re-scab each time. So we don't want to have it in the water a lot, in direct water. And then after I would say about 10 days to 2 weeks, that's when you want to start using your SPF. And that's it. It's super simple healing wise.
Amazing. And it's just a one time, like, will Sue have to come back and get any retouches or
So
anything?
it's usually 2 times. So
Okay.
she'll do one, and then anytime after 4 weeks, she can come back for a follow-up. And the follow-up is more like a perfecting session. It's like, okay, how do they feel? Do we need to balance out any color? Do we need to adjust the tone? Like anything like that. Or if she's like, Mandy, I want to go thicker, or, you know, it's like a perfecting session. And then once you have that second treatment, then that's when you would say, you know, a year to 2 years from there, she might need to come back and have it refreshed.
Yeah.
You okay with the pain?
Yep.
Okay.
When's the time frame on this?
For
Come back.
the perfecting. So you have to wait at least 4 weeks, but ideally you want to do it before 6 months. So it's like, you don't want to be like, okay, I'm here for my second procedure a year from now, you know? So you just have to wait at least 4 weeks. You know, on average, like 4 to 6 weeks is a good wait time to come back. So it's all the way healed, for your follow-up.
Yeah. They look pretty perfect from this angle, Sue. How are you feeling?
Vulnerable. I can't see anything.
No. That's great. Okay. It looks really great. Anything So actually, Mandy, talk to us a little bit about the Sauler Institute, the locations that you have, or if someone is out of this area. So right now we're outside of Philadelphia, PA. For
Mhm.
those that are national, where can they go? I know you mentioned a couple organizations but to find someone of your caliber in their area to ensure that they too get the best result.
If they contact us, we'll be more than happy if we have an artist in that area that we can refer them to refer them to. So we work with a couple other organizations too. And over the years, we started working with artists nationwide with the Selective Artist Program. And what that is we bring in artists that are, credentialed and insured and they've been trained. So we know that they're safe to refer to. And we have them all over. We probably have about 70 some artists now, all over the United States. So if you're thinking about it, reach out to us and we can see if we have someone in your area that we can refer you to.
Excellent. Okay. And we'll be sure to put the link to your website in the Facebook chat as well.
Yeah.
So we'd love to hear also if anyone that's watching live on Facebook, if you've connected with Mandy or you've had your own procedure done, what that was like, or, just sharing your experience. I think this is a really great time to, call out and normalize this type of thing for all patients, right? Because like we said, this is something that is for you and can be a real confidence booster and really just help bring a sense of self back to a patient.
Anybody there?
No. I'm sure lots of your patients, Mandy, are tuning in and singing your praises. We've had a lot of comments leading up to today, just sharing what wonderful work you've done.
Oh, it's good. I know they're like, they talk about you in all these Facebook groups all the time. I'm like, oh my God, do they? Hopefully they're talking about good things.
Yeah.
Yeah. I wouldn't be sitting in this chair, man, if it wasn't you. It's that whole control thing.
I know. Yes, Sue really does. She's like, she has to go through every step, and that's okay, That's why I like to do the process with people together, though. I don't want to just be like, to take complete control. And, of course I will take control because some people are like, what you're doing, do it, So I'll take control when I need to, but I give control when I need to.
Yep.
That's okay. Like I would rather do it together.
Yeah. It's such an artist. It just seems like such a no-brainer all these years. Why didn't we have tattoo artists doing this? They're the ones that.
Well, we did, right? But it's like now it's starting to get like more advancement, it's starting to look more natural. We have like different tools, right? I'm not making my needles, we have different tools now, and we can definitely create different effects from what we think about back in the day. It's like permanent makeup, these big solid block eyebrows, and this wasn't that pleasing looking. And so now it's great that we have the tools that we have. Even traditional tattooing, it's amazing. And to tap on that, like if anyone's interested in, doing a decorative tattoo, that's something that you can do too. My mom owns a tattoo shop right up the street. And she's been there for 36, 37 years. So I grew up in it. Their experience with working with a lot of our breast patients that decide they want to do something decorative. My son is tattooing now. My daughter is tattooing in California now. Both doing amazing stuff. And I'm just so happy. She's in Santa Barbara and she's building with a lot of breast cancer doctors out there. So it's really cool. So yes, we have her there, we have my son here, and then we have other artists. I know you were asking about the different locations. We have someone in Jersey and Virtua. I also have an office in Manhattan, so anyone from New York City or on the outskirts. I do see a lot of patients from different areas of Connecticut and Long Island and different places like that they can come see me in New York City. I'm usually in New York City several days a month. So we can schedule anybody there also. And they can have any of the procedures done at most of the locations, unless the artist just, does one procedure. But I would say most of the locations will do all the procedures.
Okay, that's great. Is there much of a wait time if someone wants to see you, Mandy?
It depends on the location and artist. For myself, I would say it could be, it just depends sometimes around the time of year that you might book, but it could be a couple months, it could be 2 months, 3 months, it could be a month. It just depends, you know, it depends on what your availability is, what location you want to go to. Like, you know, I'm only in Bryn Mawr twice a month, so it would be a little harder to get to that location. Get it? I mean, the wait time would be a little longer. But Carla is someone that does all our coordinating and scheduling. Carla Sanchez, and you guys can call or email or text her. And she's like super helpful. She's been with me for over 10 years, so she'll be able to answer any questions you have and look at the schedule. So you know, she's really good with that.
Wonderful. Yeah, and certainly let them know you're with Unite for
So I got a
Her.
little bit more to do on the right side. Sorry.
Yeah, no, that's okay. And actually, Mandy, so with that, so we're right at 5 o'clock. So they look amazing. So
And we're almost done. Like we literally have like, you know, just to get this last one done. You know, I'm talking the whole time.
Well, I was going to say what we can do is wrap up and let's post some of those before and after pictures. I mean, from here, we're
that would be great.
left brow. It looks amazing. It really truly.
The best type girls here in our community, just so you know.
Listen, we got to support each other. We got to show our love for one another. This is part of it. So
I love it. I love supporting women. You know, it's just so awesome. I tell my daughter, when you see a girl, just smile at her and just everything goes away.
absolutely. Absolutely. Good. Okay. So we'll let you continue. Is there anything else you want to share, Mandy? We'll be sure to post your website for our Unite for Her members to reach out to you. We'll definitely post.
We do have training too. So, you know, if it's a medical provider that might be watching now or something like that, you know, we've trained hospitals, medical providers, you know, anyone that's maybe a tattoo artist or a permanent makeup artist, or, you know, you're working in skin already, and we do trainings for this. So, and we train people from all over the world before. So, they can inquire about that. I also do mentorships. So if you're not local, we can do mentoring too. I have a new app. It's called Tattoo Mentor. So they can go on there. There's lots of free stuff on there now too. I just launched it, so I'm kind of excited about it. So Tattoo Mentor, and they can go on there. It's just on the Apple and Google store. They can go on and download it for free. So the trainings are there for any people that will actually be providing the procedures, and also the cosmetic stuff.
Wonderful. Great. And again, if you are a Unite for Her member and you're reaching out to Mandy and her team, please be sure to let them know that you're part of our community. And Mandy and Sue, looking good over there. We want to thank you. Definitely be on the lookout. Our Unite for Her community will be posting those before and after pictures. And before we close for the day, again, I just want to remind everyone that we have another Ask the Expert coming on Friday. So we will be talking with the Boobie Doc, Dr. Robin Roth, and she will be going over breast imaging myth busting. So anything that you may have heard, feel free to submit your questions to us, uniteforher.org/experts, just as you did for our session with Mandy today. I want to give one final thanks to our amazing education sponsors. Today's Ask the Expert is presented by West, Merck, Daiichi Sankyo, with additional support from Lilly, GSK, Gilead Sciences, Pfizer, and Immunogen, now part of AbbVie. So thank you so much for joining. Stay tuned for before and after. Definitely inquire about all of the amazing services that are available to our community. And we thank you so much for joining us today. Everyone have a wonderful day, a wonderful afternoon, and hopefully I will see you on Friday. Take care.